we have a sink here, and this is a room that Child Hope keeps a lot of their disposables in. And we use it for our compressor room. It's great because it's far away from the patients, and we actually have one outlet that works here. Anyways, this is our compressor. It's hooked up to this orange hose. It's a 50-foot hose that runs through all the way into the clinic. This area right here, we used to keep a Statum sterilizer, and unfortunately we found out that the voltage in this building was just too variable for it to operate the Statum properly, and it kept having issues with it. So now we keep the Statum over at the guest house, and we we sterilize the instruments there, and then just shuttle them back and forth as we need them. Unfortunately, the Statum is not working right now on this trip, so we've resorted to just boiling our instruments in bleach water and just bringing them back and forth like that. But normally we would have a Statum here that works. I'm sorry, we would have the Statum that works at the guest house, and you still have to shuttle the instruments back into here. This air hose runs up through here, and what we normally do with this compressor is when we're through with this trip, we're just going to simply store it underneath the sink right there, over to the right. And then the hose would probably be wound up next to it. The hose is just simply fed through into the pharmaceutical room right here, through the window, right next to the hose that you saw for the suction line coming through the window, and then going directly into our clinic room. The hose then connects over and actually powers our high speed right here. Now, this is a self-contained unit. This actually has a high speed and a low speed provision, a 3-way syringe, and also a slide ejector. Now, this whole thing can actually be operated totally by itself. It actually has its own compressor, water supply, and a little cooling fan, and all you need to run this is just simply 110 voltage. However, the air compressor in this is just not quite enough power to really cut good. So what we've done is we've simply disconnected the power which goes into its manifold, and then connected our external air compressor directly to this. So I just simply use everything on here minus the air compressor. So now I've got a really nice air compressor with 40 psi at about 1.5 cubic feet per minute operating this thing. This is a very unique little foot pedal that one of the staff members, in fact our cameraman right here, rigged up. And it's just a simple air compressor controller, and it's hooked up so we can use it as a foot pedal right here. And all you do is you just simply use this, and this is what drives our high speed, just like you see here. Works quite well. We have water spray, pretty much. Now you can hear the compressor kick on back there, but pretty much like your own practice. The only thing is you have to have your foot pedal on while you're using the 3-way syringe tip. This is the only frustrating thing we have. Every time you want to spray the patients off, you can't just grab this and do it. You're going, there's no air. You have to press on the foot pedal to allow the air to run through here, so you can do that. The next time I come here, we're going to modify this so we'll have air full time with the 3-way syringe tip like this. For the low speed, rather than using a low speed air driven, we just simply used a electric one. This is the same megatorque unit that the hygienist uses, and it is a great low speed unit. I have a regular contra-angle high-speed friction grip contra-angle chuck on there, and I just use the exact same burrs for doing the high-speed prepping as I do for the low speed. And it's beautiful. It works really nice. It has its own little rheostat control right here, and I do believe we have it turned off right now. Yeah, we have it turned off as we're doing kind of a shutdown of this place right now. But and that's pretty much it for the dental high speed and low speed and the suction unit. What we've also done are use some of these tackle boxes here that you use routinely when we're working on patients. This thing really works great. I researched a lot of tackle boxes. This is a Plano. I don't remember the exact model number, but it is the only one that's got these trays large enough to fit a lot of our dental instruments in it. It just works fantastic. I got all the surgery stuff on the top, and then we've got our anesthesia, the topical second row. This is all paraphernalia for doing fillings, matrix bands, things like that. And then our supply of composites and bonding agents and resins and things like that down here. A lot of our surgery stuff I put up here on top. This whole thing just folds up, and it's just a great little tackle box. You can, put it in one of the duffels when you ship out, and you open this up and you got an instant dental office. A lot of the extra stuff that you see here are disposables that we keep. They're kind of bulky to store in this, so a lot of the disposables we keep that we brought with us, we kind of keep it away from here, and we just bring it out as we need it like this. The only thing that takes a little bit of getting used to is the light. Now, we don't have a dental operatory light here, so what we're using is just a simple headlight. And the dental units like this cost around anywhere from $500 to $1,000. This, you can pick this up at REI, and I recommend the Black Diamond brand. They're the brightest, and this particular unit is one of their brighter units like this. It just takes 3 AA batteries. This thing lasts for quite some time. I used this for the entire 6 days I was here, and it still has enough power. The intensity on this is brighter than any dental light that I've seen. Now, it doesn't have quite as fancy of a cutoff of light area, but patients, your idea is you're trying to do this dental work, this is more than adequate lighting. It really works nice, and on top of that, it's around $50 or so. You can't beat it. It's the best way to go. The only thing that takes a little bit of getting used to is when you're using this and you have the patient here, the minute you look away, the light goes with it. So your assistant she's blind. She can't see what's going on. So until you bring the light back into the focus, unless your assistant also has one too, which kind of is nice if the assistant has a headlight too. But actually, the lighting is really good. That's not a problem. We're using a standard table that we picked up at Walmart. I think these were about $39 for these tables. And this is just a typical office chair, whatever we found. Last year we didn't even have the luxury of using these chairs. We actually had plastic chairs that we had to pile up. The only thing is you can't raise this up high enough and you can't lower this low enough. So when the patient's laying down and you're working, if this is too high, you end up doing a lot of stand-up dentistry, or you can put some pillows here and makeshift. You pretty much got to do what you got to do to get the job done. And last but not least is our stereo system here. You've got to have some kind of sounds. You're seeing patients here one after the other. People will line up for dental work. People will wait here all day long to have something taken care of in their mouth. And so you could be here as long as you want and literally see patients 24/7 if you got the stamina for it. So I recommend having some music, and that really makes the day go a lot nicer and smoother. And I think we've covered just about everything here. Most of the equipment here is for Child Hope's Pharmaceuticals. Like I said, this is normally used as a examination room, and we're just using it as a dental room, and it just works really nice. And we have 2 of these tables, so we're able to see one patient in hygiene getting his teeth cleaned while I'm doing fillings over on this side. What's really unique about us is that most dental teams that come down here, they basically don't bring this kind of equipment. They just bring forceps and elevators and anesthetic, and they extract teeth, which needs to be done. We're one of the few people that actually do fillings here. I mean, we actually drill and do cavities, and people that, a lot of these places will take a tooth out with just a tiny little occlusal filling on it because they know that patient's going to have issues later on. And so we're able to take care of that. We're able to drill in there and actually put a filling. We're using composites, and we're able to actually put a filling into the tooth that normally would be extracted. And last year we saw some 80 kids, and those teeth, we have a little dental curing light here. This, by the way, is a really excellent light. This is the Fusion light. Very portable, very, very bright. It's basically a 3-second light. Very easy storage. It's actually lasted all day long on us when we're using this. But it's really amazing to see the kids at the orphanage. None of their teeth are great, and they don't have extracted teeth. When you look at most of your adults, most of the adults here have at least 4 to 5 teeth missing in their mouth, and fillings are basically unheard of in some of these places. And so we're actually doing something that I think a lot of dentists don't get a chance to do, simply because it takes a lot of work to bring all this inventory of equipment, and you just got to have so much stuff we were able to just improvise most of it and bring the necessities, and it's really worked out quite well. And God has really blessed us with this. It's just been really tremendous seeing the kids, especially coming back in the next year, seeing how they've improved with their hygiene, and they're actually happy to see us and everything. Most of this equipment we take back with us because we use it for missions in Mexico and places like that. A lot of the stuff we keep here. We keep the compressor here, and we'll be keeping the other suction unit here. All these other things, I'll actually be storing these at home. And anybody that wants to come here and bring some of this equipment, you're welcome to use it. Just simply contact the church, and you can get in touch with me, and I'll go through everything with you again, and you can take all this with you. And it's just a blessing for everybody. It's just so rewarding to be able to do this to people.